So my name is Dr. Susan Kuchara. I'm a naturopathic doctor, and Microbalance Products, they actually asked me to join their live because we've been talking back and forth about so many case studies that have been so interesting using their test kits. I've been using their test kits for my patients for years now, and so we thought it would be really great for me to join and answer any questions. We did receive some questions over the last 24 hours that I will answer. Thank you for submitting those, and also anyone on the live who has questions. If they've been looking for these mold plates, you're seeing them on Instagram, not knowing if they should buy them, if they have clarifying questions, I'm happy to answer anything. And then if there are questions that I'm not sure of, we do have some ladies here from Microbalance that will be on in case there's some things I'm not privy to, and they will answer those for you. So has anyone here seen a naturopathic doctor before? And I'll see if you can comment. So I am licensed in both California and Connecticut. I have a virtual practice. I graduated about 10 years ago because of my own journey with chronic Lyme disease and being undiagnosed for over, I would say, 15 years. I became very involved in the mold, chronic Lyme, chronic autoimmune diseases, and just that chronic disease population and community, and we've really become a community. So I'm just reading what you guys are saying. Okay. Functional doctor. Okay, yeah, so naturopathic doctors, we actually attend a 4-year naturopathic medical school, so we do learn all the basic sciences that a medical doctor learns, but then we learn all the amazing naturopathic philosophies. So using botanical medicine, nutrition, Chinese medicine, and really that naturopathic philosophy of root cause, making sure that we use nature and we know that the body is resilient. Given the right environment, it can heal. So with that being said, I wanted to jump in and answer some questions. One of the questions first I thought would be good to address because it is asking about symptoms of mold. So a lot of people are having vague symptoms and they're not sure if it has to do with another disease. And sometimes it does share other diseases, but there are sometimes clusters of symptoms that would make you think more mold. So beside one thing I would say first is respiratory symptoms. So those are the first things people think of. Asthma, trouble breathing, sinus infections. I literally just got off the phone with a patient who is in a moldy home, and she's actually doing really well. She can't move just yet, and she's doing really well healing. And you can heal, while you're in a moldy environment, which we can talk about, at least until a person maybe be able to move, or let's say they're not able to. And she has a sinus infection that has lasted over 2 months. And we know that it's probably because she's in an exposure to mycotoxins, and we did use her mold plates. And so respiratory issues are the first thing we think about with mold, right? So besides that whole upper respiratory tract, coughing, even sore throat, waking up very congested, mucus, you can have all sorts of like rhinitis, eye tearing, etc. So you think respiratory, and then you also think of what's going on with the gut. So mycotoxins, mold illness can absolutely affect the gut. It can be a lot of times SIBO, so resistant SIBO can actually be mold illness. And then it can be vague symptoms like my stomach hurts, right? Or I'm having some acid reflux, or I'm just having indigestion. So it can definitely affect the gastrointestinal tract. It really affects every organ system. So think respiratory, gut, and then there are certain symptoms like metallic taste in your mouth. It can also be something called static shocks that you'll feel in your body. Another one is urinary frequency. If you feel like you're going to the bathroom continuously, mold can actually affect our antidiuretic hormones. So we actually will be urinating more frequently, as well as urinating a lot throughout the night is a big symptom of having mold illness. I don't know if any of you have experienced any of those. Also, mold can cause issues with our thyroid. It can cause autoimmune processes to start. And then you think of what does it do to our energy, right? So we can be really fatigued, feeling like we're just dragging ourselves. No matter how much we sleep, we're not waking up rested. What other ones I wrote down so I didn't forget? Weight loss or weight gain is actually important to know. So some people, because of the inflammation, they can gain weight, and some people actually have the opposite reaction and they can lose weight, right, when they're not even trying. What else do we have here? Hair loss, right? You think hair loss, it's just hormones or it's maybe a vitamin deficiency, but it can be mycotoxins. And this list is, can go on and on. It can affect your musculoskeletal tract. So basically, when you're talking to a naturopathic doctor or a functional medicine doctor, we're listening for these subtle symptoms that we say, okay, this may sound like mold, but this can also sound like other symptoms. A lot of times mold and Lyme symptoms can go hand in hand. So I wanted to answer that question first, is what are the actual symptoms of mold? And then we had another question, how do you use the mold plates with your patients? So what I do is if a patient comes into my practice and they say, hi, I have X, Y, and Z symptoms out of the ones I just shared with you. I'm really not feeling my best. And then I ask them questions, do you feel better when you leave your home? When did these symptoms start? Oh, I moved into a new home around that time, or I started a new job around that time. So I ask a lot of clinical personal history questions. And then if I suspect that the patient is having an exposure to mold, one of the first things I will do is I will test their blood for some markers. So I do check a marker called C4A, which is called complement 4A. I do check another marker called TGF-beta, factor beta. That's another one that is also elevated when someone has mold. And I usually start there as number one. And then I also tell them that there's a really inexpensive way to screen. Not every patient can afford someone to come into their home and do mycotoxin testing right off the gate, especially if we want to help them see first if there's a problem, right? So if the patient has those symptoms that's making me think it's mold, or their mold markers are looking that their mold markers are elevated, then I will tell them to get the EC3 mold plates. So this is how the outside of their package will look. And we have here the plates. So what we will do, and I usually tell my patients, is to do multiple testing. So it comes with 6 different plates, and you can go in all the rooms of your house. But one thing we do suggest is that you're doing air sampling and you're doing a tap test, because it gives us more clinical data. So for example, if you have a room with a carpet, you would do something called a tap test. So you would just take this side with the agar, the sample plate, and you would just tap either your carpet a few times. You can do this with any type of furniture. And you would do this tap test, and then you would close it, and then you would put clear tape around the outside. You would label it. Okay, so this was the carpet in my bedroom, and I did it at this time and this date. And then you're going to cover it with aluminum foil, and then you're going to put it in a place where it could sit for 4 to 7 days. So they do recommend at the company to put this on the top of your fridge, because it will then be able to have some of that heat from the refrigerator coming up. So you want to do that for at least 4 to 7 days. And when you open up your plates, if it has, and this is a really good picture, I don't know if you guys can see, but you will see this on their website or at the testing plates. You will see a little guide of how many spores, and then are they problematic depending on how many spores and colonies that you actually find. So if you only have a few, let's just say 1 or 2 or 3, may not be an issue. Or actually, I'm sorry, 1 to 2. But once it's at 3 to 5, then we say there's a moderate risk for inflammation. And then if it's 6 to 10, we say it's a high risk of inflammation. And then 10 plus, this can really cause autoimmune diseases. So if these do come up where you are having several colonies, that's when we know, okay, mold is a problem. And that's when it would make sense for you to find the source. So then it would make sense for you to find a proper mold inspector. If you do live in New York, I know a really amazing mold inspector that travels to people, and he also actually does virtual, so you can DM me for his information. But I do this first because a lot of patients have to see a problem before they might have to go out and spend money on a mold inspector. So this is usually my first mode of action to be able to determine, does this patient have a mold problem? And what I'll also do is I will have them do air sampling as well in that room. So for air sampling, you would go into the room, you would leave the plate open for 1 hour. And then what you would do is you would turn on your HVAC, you would turn on any type of either air conditioning, heating unit, let it circulate in the room for an hour, and you would shut the door. And then after that hour, you would do the same exact thing where you close it, you would put the tape around it, you would label it, and then you'd put aluminum foil on top of it and then put it in a place for 4 to 7 days around 70 to 72 degrees. So you can do, it comes with 6 plates and they're $36. So they're super affordable for you to do multiple places in your home. So I don't know if you guys have any questions about any of that before I go to one of the other questions that was submitted. Anything that you guys have questions with so far? Okay. So we talked about the symptoms of mold. We talked about how we actually test them, why I test them with patients. And then someone asked, how often do I test my home? So that really just depends on if you are feeling sick or not. If you're feeling great and you don't have a reason, let's just say you're pretty healthy, you don't really have any symptoms, you didn't have any, known water damage in your home, there wasn't a leak, then it may not be necessary at all, right? But did you have, for example, did you have a previous problem? Did you have a previous mold problem? And then if that's the case, you might want to check it a few times after that, especially if you were to remediate. Also, if you have an autoimmune disease or Lyme or an HLA mutation, which means you're not able to detox the mold properly, then you may want to do it at least 3 times, maybe 2 to 3 times a year. And the Microbalance Company actually gave me an example that they utilize this test. They've had a patient who, for example, would flare with her autoimmune disease when she was exposed to mold. So it would be something that particular person then would test more often. And then what's the question? So Catherine and Nicole, do black mold spores indicate a more severe mold? Well, yes. So I would love to know the actual color. So Catherine and Nicole are on here from the company, but so obviously Stachybotrys, which is black mold, is going to be more harmful to you, but I'm not sure if the color is actually black. So let's see if they will answer that part. But if it is Stachybotrys, it is a severe mold. And then the dust test. So and I'm also going to have them ask, because this was actually a question I have for them too. So I'm an expert of how to help with mold in the body, but I don't know all the questions about their specific products. So they're going to come in and jump in with some of these. But from what I know, you can do a swab as long as it's sterile, and you can collect dust, and I'll see if they will confirm this here, but you can actually do dust as well. So, but again, you want to make sure that your swab is sterile, because you don't want to be using something that's not sterile, because you're not going to get accurate results. So regarding the black mold, it being black, is it more severe? So Catherine had shared from the company that not always mold comes in many colors, and you can send the mold plates that culture into a lab. Exactly. So they have an option where you can take your actual plates and send it. There's a place on their website where you can send it out, where they will tell you what exact mold, if you want to know, is cultured on your plate. And then, can mold stay in your body for years? Yes. So it's interesting because just yesterday I was looking up some articles, because we wrote a mold article. Dr. Sparks in my practice, she's a naturopath like me. She's also an expert in mold. She was mold certified, and she wrote this really amazing article. And I was looking up some other articles online, and Healthline was saying, I think it was like, you do not need to detox mold after you've left. But I have not seen that to be the case, because if you are a slow detoxer, if you don't have your detox, or let's just say your pathways of elimination are not open, I see a lot of patients who are suffering from the aftermath of leaving a moldy environment even after 1 to 5 years later or more, and still coming up mold markers and still experiencing mold symptoms. I just had a patient recently tell me that they had a black mold exposure in their home, and during the time, every time they would have a bowel movement or urinate, it would smell like mold. And she said, even though that was 3 years ago, she still is smelling mold when she goes to the bathroom. So that already tells me that and they remediated and they got rid of all the mold. So I do think that it's important for some people to make sure they detox after, because some people do have an HLA gene mutation where basically 1/4 of the population cannot get rid of their mold properly. They can't detox it. So maybe the people who get out of the mold and feel great, their body detoxed it, but that's not the case for all of us. And then, okay, exactly. So Catherine from the Microbalance Company, who makes these amazing little plates, she said dust tests are good, but don't always show you exactly where the mold is. You can do multiple dust tests, but they can be very expensive, right? Because if there's air blowing around, we're not necessarily sure where, for example, if you were to just put this in a room and you did a tap test on the carpet and you did an air test in that room, and we see that both are coming up, with tons of colonies, then we would know, right? So opposed to if you're doing the dust test, we're not always knowing basically what she's saying where the actual mold issue is. Is there any other questions? Let me see if I missed any. Okay, I think I got those. Yeah, so Catherine had said, my opinion is the dust tests are especially useful, right? Or these ERMI tests when you're looking to buy or rent, right? Because it's basically like, if you've ever seen them before, it will show you a score of the whole home, right? And then it helps you get a read on the home when you have little time to make a decision. So that's the question about the dust testing. Any other questions that came up about that? I can go to some of the other questions that were submitted. Yeah, so that was actually one of the questions regarding, should I do an ERMI or should I do these, and what's the difference? So we were just talking about that. So these ERMI tests are more of the DNA tests, and basically what Catherine was just sharing. It's more helpful for those reasons than sometimes wanting to know each room, right? Where is the source and where is it coming from? And then, let's see what else. We talked about how often to test the home. Oh, someone asked, how do I tell if my washing machine is potentially moldy and affecting my clothes? Can I use the mold plates? So what you would do is you would do your load of laundry, you'd wash your clothes, and then you'd let them dry. And then instead of doing, how we said a tap test on your carpet, you can do a tap test on the actual clothes, right? And what's important about your clothes is it's on your body, right? So if your clothes are on your body and this is your nasal passage, and that's the first place that mold's gonna go, is right through your nose, right? And then so after you tap test it, then, okay, this potential issue in the washing machine, and what you can do is use their laundry additive to clean your washing machine, especially if it's a front loader, or there are patients where their machine is infiltrated with mold and it's better for them to just replace it. And then, but yeah, we do recommend using their laundry additive. I personally use it not only to clean the washing machine, but then I also use it when I'm washing clothes, just in case, right? So you can absolutely do that. And then someone's asking, how accurate are the test plates? Can you get false positives? So and I'm gonna have Catherine and Nicole confirm this, but from what I learned is when you get a positive, it's usually a true positive. If you get a negative, it could be, and correct me if I'm wrong, but it could be that there was maybe high humidity, right, in the room, or that, let's just say you live in a really humid environment. What can happen is it could show that there's no mold spores. So what they have you do for things like that is, if you're living in that type of humid environment, you would just disrupt the air somehow. So fans or blowing, and then do the test again. So let me see. So that's what I would say there. And also, it may not actually be in your home. So for example, some people don't have mold in their home and it's in their car. I think there was a specific BMW series, and I don't remember the one, we can probably look that up, that they actually had a really bad mold problem. So the one thing is, it could potentially, if it's not showing up, it could be somewhere else, right? There could have been too much humidity. It could be in the car, it could be in the gym. I have patients who are nurses who work in hospitals and they're exposed there. I have patients who work in schools who are in water damaged buildings. So it sometimes may not actually be in your home too. It might just be too humid. And then yes, exactly. Catherine confirmed, I'm right. They cannot culture something that isn't there. Right. They cannot culture something that isn't there, but not all mold is culturable. I love that. That's awesome. Yeah, so it would be rare to get a false positive. So that makes sense. Yes. Yes, so you need to, right, so exactly. So, one second, Catherine. You did hear that you need to turn off fans when testing. So, correct me if I'm wrong, girls, but you would, if someone was in a humid environment, you may have them put the fans on to disrupt the air, but you wouldn't necessarily turn on fans when testing. Can you confirm that? I know that they like you to disrupt the air when it's humid so that the test kits can be more accurate. Let me see if there's any other. I think I answered all of those. What other questions, guys? Okay, so that's a good. So you can leave the fans on to answer your question, but obviously don't use air purifiers. So the fans being on is okay, especially if you're doing air testing. You would leave, it's okay if there's any type of ventilation in the room because that's how you want to test the air. And obviously, if your air filter's on, it's basically you're not going to get super accurate result. But obviously, if the air filter is doing its job. And then, yeah. Okay, what other questions do you guys have? I think I answered all the ones that were submitted. Let me think of. And one thing I want to share is because a lot of people in this community, they feel really, actually, this is one other question. If I can't remediate, should I still test? I'm scared to know if there's mold in my home if I'm not able to do anything about it. So there's a few things there. It depends on how many symptoms you have, how sick you are, right? You have to be the judge of what can your nervous system handle. What's worse, you staying in a moldy environment and not knowing, or you knowing that your nervous system can't take it, you're moving in a short time frame, so you know what, I don't even need to see this right now, right? Let me go based off maybe some of my blood tests, see if I have mold, or urine tests to check if I have mold. It really just depends, but I do want to encourage you guys to know that I have several patients who get well in a moldy environment. If they have severe illnesses, it might really elicit them, they have to move, right? But if someone cannot leave their current environment right away, right? You already bought a house, or now there was a flood, or there was a leak, or plumbing. Not everyone can just say, I'm moving to a new house, or I'm going to remediate when it can be, over tens of thousands of dollars. So what I personally do is I work on the patient's drainage pathways. So I make sure that all of their organs of elimination are open. So do these patients, are they having normal bowel movements? Are they sweating? Is their kidneys and liver open, right? And I use homeopathic drainage. I really, really love that to help open up all their pathways of elimination. I then make sure they're getting foundational nutrient needs met. I sometimes will use binders. So it's really important to know that you could still start to heal. Is it a perfect, picture to have you living in a moldy environment? No, but a lot of us are. And I see people all the time get at least 75% better because we're keeping air filters on in the house. We know where the source is. So let's say the source is someplace, maybe they're not going to go to that source. Maybe it's in the basement or it's somewhere else that they can maybe avoid a little bit. So I just wanted to mention that it's not all doom and gloom that you hear where, you have to move out or you have to remediate or, you're never going to get better. That is the case for some people, but I have several patients of mine where that's not the case. And then Catherine said, you want it to be as much like when you're hanging out in the space as possible because you want a picture of what you're breathing when you are there. Right. Okay. Yes, that makes sense. And what herbs would you recommend for lymphatic drainage? So the first thing to think of even before an herb is making sure you're walking. So walking is very underrated. When you walk, your lymphatic system is moving. So walking and sweating, really, really important. Jumping on a trampoline, also really great for lymphatic drainage. And then herbs, there are one called Cleavers is really good for lymphatic drainage. Cleavers is good. You could do like a Cleavers tea. They have really good lymphatic combinations. So for example, Professional Formulas has like a lymph stim liquescence. It's a homeopathic drainer and it has a bunch of awesome things in it. And then there are also tinctures of a bunch of different combination herbs for lymph. And then let's see what else. I think I answered those. What other questions do you guys have? I want to see if there's anything else that I didn't answer so far. Is anyone living in mold right now? Does anyone have really bad mold symptoms and they're not sure? So one other thing I wanted to mention is if you are in a moldy environment and you cannot get out, one of the other things you can consider is their foggers. So you can, or let's just say you're moving and you do not want to, let's say you can't afford to replace all your furniture, you can fog it down. And I just learned yesterday actually that you can even fog, like it's so safe that you can be there while it's being fogged. It's not chemicals. So they do have those on the website. But I really think that anyone who is concerned is, just got my plate. Okay, perfect. So you're not sure, you just got your plates in the mail. So they do come with 6. So I would recommend doing a tap test in every room where you can, because where there's things that would make sense to tap, because then that would give you more information to then figure out, what's going on in that room and be able to analyze it better. I got 5 black mold colonies on my mold plate, but was told by mold professionals there's no mold. Any idea where it would come from in your experience? Oh, I'm not sure. Catherine or Nicole, what do you think about that? So did this mold professional go into your house and do source testing? What did they do? Did they do air testing in your house? Did you test the actual plate? Did you do ERMI? I was thinking the same thing and I didn't want to be a jerk. Catherine said, hire new mold professional. Kidding. But there's something there, maybe your carpet or crawl space. That's actually also things to remember too. People have like things growing, like food that got stuck, right guys? I think it can go under your refrigerator, or there could be things that you're not even thinking of. So I remember when there was a patient saying there's no mold, and I was convinced there was mold. She was like, have them keep looking. And sure enough, they found it. What do you recommend? Would you recommend fulvic and humic acid as binders. Yeah, I think they're great binders because they are gentle and safe enough. I do think that anyone who starts a binder should be very low and slow. Don't start taking high doses of binders right away. It can really aggravate you. So those seem to be, my patients seem to do well with those. So those are okay in my book. Some people will do apple pectin. Some people will do chlorella as a binder. Some people will do citrus pectin. Those are good too. And then, so Catherine, she just checked for moisture in the walls. Okay, so maybe that's why, is that there probably wasn't enough. Hold on, let me see, there's a bunch more. Yeah, exactly, Catherine. If you don't feel well, you trust your awesome body over a professional. Exactly. Sometimes when people tell you things and your gut saying that's not the case, you listen to yourself because your intuition is generally right and it's usually telling you something. Yeah, see, Earth Angel, I love your name, has had more professionals not tell the truth, get another professional. Yeah, so it just depends. I feel like I had someone come into my home at one point and I just didn't feel like he was really looking as in depth, or I don't know, I just had a feeling. So not all, it's kind of like, they might be all certified, but not everyone is the same quality. So I would keep digging is basically what Catherine was saying. Yeah, Annie, I think, yes, my thoughts exactly. I feel like charcoal is a strong one. Maybe start with fulvic. Yes. So charcoal, let's just say that's all you have. It's cheap. You want to make sure it's always away from food because it binds minerals. Most binders have to be away from food. But with charcoal specifically, it binds a lot of your minerals. So you don't want to eat a meal, right? And then all those beautiful nutrients then get bound up to the binder and then you're pooping it right out. So you want to make sure with charcoal, I only do that if someone is having like an acute flare and that's all they have at home. It wouldn't be the first thing I choose, but sometimes people can do like a coconut charcoal, which could be a little bit, easier on their system. So that's something else to consider. And then what else, guys? What other questions? And there's things that you guys can do to just support yourself, right? Like just on a daily basis, right? If you're not sure you have a mold problem or et cetera, I personally put just this morning, I put the EC3, their spray solution, I put it in my dishwasher, right? And I just let it run just to get any mold spores out, right? Because it's a damp area. Same thing with the washing machine. So you can do things to just support your environment. Do you need to worry about binders and hormones if you're taking them a long time? What do you mean? Do you mean taking or binding hormones, you mean? Or do you mean if you're taking bioidentical hormones and binders? I just want to make sure I understand what you mean. Do you mean could taking long-term binders affect your hormones, or can you take bioidentical hormones with binders? Or do you have another question? Maybe I'm just not clear with your question. Oh, like binding to hormones. I personally don't have any patient on anything long-term other than maybe bare bones basics, minerals, omega-3 that your body doesn't make, vitamin D or probiotics. Those are my basics that most of my patients stay on to maintenance their health. I don't have patients on ongoing binders. I usually do it for an intentional. I can imagine if you're doing them for long-term, it can cause some potential imbalance. Could it affect your hormones? Possibly. I just don't do them for long enough for it even to get that far. And if you have more questions about that, let me know if I'm not answering. Is it normal to feel worse before getting better? Yes. Yeah, because especially if your detox pathways are not really, if they're not working well and now you're detoxing a bunch of mold, you're going to feel crappy. So you just want to make sure you facilitate that the best as possible. So castor oil packs, dry brushing, sweating, getting in an infrared sauna. So you want to do things while you're detoxing from mold and know you're going to be tired. Rest, drink a lot of water, make sure that your diet It's full of nutrients as well as antioxidants to help with all the oxidative stress, with all the mold that is basically getting detoxed out of your body. But a lot of times in naturopathic medicine, it's not really glamorous, but when the body's healing, a lot of times it has to go, in reverse order, right? So sometimes things, old stuff gets trudged up. If you're detoxing stuff, you're not going to feel the best. And then all of a sudden you kind of push through it and you go through it. But you do not need to take large doses of things. I end up seeing so many sensitive patients. That's pretty much my patient base. I'm super sensitive, so I'm very good about not overwhelming the body. If you're not feeling well in the detox, go lower. Like it's not, it's not something where you need to just push through and feel horrible, especially if you have a family or you have a job that you need to attend to. You don't have to go. I tell my patients, I'd rather maybe this take another month than you feel horrible every single day, because we want to get this out. And also you don't want to overwhelm your detox pathways, right? Your kidneys and liver have to get this out, so you don't want to be pushing them. Let's see. Yeah, I know with the binding to hormones, I'm gonna ask Dr. Sparks if she feels that long-term binders can actually bind to our hormones. If they combine to nutrients, it wouldn't shock me. I guess because I've never done it long enough, that has never been a concern, but that's a really good question. So I'm going to get back to that question after I consult Dr. Sparks. Yes, important to massage your lymph nodes regularly, absolutely. So also, you can just look up on Google, where are our lymph nodes, right? So even every morning, you can just do your own castor oil lymphatic massage, right? Your drains, you're always going to go down. You're never going up. So you could just put castor oil. You can put, I really love, there's a lymph lotion called, I think it's called Cleaver. They changed the name. It's by Genestra. And you can rub it in even to lymph nodes. Let's just say you're acutely sick, but it has herbs in there that help move the lymph. And you can just rub it. You can use just plain castor oil. You can use anything that's just going to help move. And you can do it right here, right, to drain your head, your neck, your brain, everything. Okay, you can do that. You can do the lymph nodes near your legs. They're usually tender. And you can do any type of your own at-home lymph massage. You can go to a professional who does lymphatic massages. And then, in your experience, how quick do you see people heal? I'm going on 4 months and still feeling symptoms. So, it depends on how compliant they are, how bad the mold is. So, I would say, the only reason I'm going to bring this patient up is because I literally just had her right before this call. I think when we found out she had mold, so I did mold markers on her in her blood. Then she did the mold plates. And then we started draining her. I did all the foundations. I would say she probably started feeling significant symptoms or reduction in symptoms in about, I would say, a few months. But even month 1 and 2, she started feeling a bit better. So some people just need time and they need longer time to heal. Some people maybe need new products. Maybe the things that you're using are not good for you. Maybe they need to be changed. Maybe you've done them for long enough and now you need to switch. I would say really, if you can give me a little bit more info on that. And of course, guys, I'm a doctor, but I'm not your doctor, so I'm always going to answer what I can, but I don't know your whole health history. And I can't give specific medical advice, but I can at least guide you in the right direction. Let's see. What else, guys? Any other questions? Oh. What are your thoughts on borax foot bath? I love borax. I personally used to use them at one of my mentors. He has this amazing center in Arizona called American Center for Biological Medicine. And I used to sit there in between my shifts in medical school, and I would go to his office and I would put my feet in the borax foot baths. So I think that's great. What other questions? trying to think of anything else I didn't share with you guys. So one thing on the front of this package here, it says, I really like this. Every home has some mold, but not every home has a mold problem, right? Mold ubiquitous, it's everywhere. So we can't expect to have none, and we live in this Puritan world. It just doesn't happen. Let's see here. Alyssa, I've been on treatment for 7 months now. And my practitioner told me it can take 18 to 24 months. Yeah, if someone has SIRS, right, chronic inflammatory response, and they've been in, if they have an autoimmune disease, if they have really severe mold, it can take a while, but you want to start feeling better. You want some symptoms to start resolving. Do I need to get rid of all of my belongings if I'm moving into a new place out of a home that has black mold? So Catherine and Nicole are going to confirm what I'm saying right now, but from what I know, you can use their fogger to fog all of your belongings. I think she even said yesterday that they would like fog themselves. Like they would all fog themselves and what they were wearing. That's how safe it is. But it's also super effective. So if Nicole or Catherine, if someone had black mold, depends on how sick you are, but not always. Are you referring to the, do you need to get rid of all the belongings question with the fogger, or is that another question? I want her to clarify that. But I know some people will use the fogger. Right, I think she was referring to, depends on how sick you are with the 18 months. Right, I haven't seen it take that long. Yeah. Non-porous things can be cleaned usually, right? So like desks, right? You want to be careful of like books and things that are porous. But from what I understand, I think that fogger helps with the porous ones. I can be wrong, but I'm going to have them confirm. I'm interested to see that fogger. I've been eyeing it on their website because patients have these questions all the time. Okay, we're going to wait for her to respond to that. Any other questions, guys? I hope this is helpful. This is why I say with my patients, test, don't guess. It's affordable enough to be able, for $36, to check your home. Oh, okay. So fogger can be used for the belongings. So I was right about that. But if you are super sick and reacting strongly to a belonging, best to get rid of it. Okay, that's absolutely fair. So you could try to save as much stuff as possible, but it depends on how severe your symptoms are. Some people, they're like, I'm leaving it all behind. I don't even want to chance it. Whereas other people, they can't afford to do that. So you just do the best you can. And again, like she said, depends on how sick you are. I want to make sure I went over everything with you. Oh, another thing that you can do too while you're living in the exposure are the EC3 candles. So if you go back to our post, if you look on we did a collaboration post of my patient with her mold plates before the candles and then after, to show you how effective they are. I know, Catherine. It's so terrible that, some of us have to deal with this. And, a lot of people don't realize the amount of emotional and traumatic involvement when you have to move out of your home, when you have to get rid of belongings that have potentially sentimental value to you, when there's a financial issue. So it's terrible. We're so sorry that you're experiencing this right now. I was wondering about the fogger for books. I've definitely been very sick, but I've stayed in the environment. Okay, very, very sick. Oh, I'm so sorry. Yeah, so for the book, so basically I think what she had said was just make sure, depending on how sick you are, it might be worth getting rid of them, but you use your intuition. Exactly. Try to save things, but trust in your body in the end. Of course, you're welcome. I came in late to the live stream. Will there be a way to rewatch this? Yes. I'm going to save this and then we're going to post it. Love the candles, Earth Angel said. Where do you use the candles? Do you put them all over your house? What have you noticed? Have you noticed your symptoms get better? Oh, perfect. So Catherine said DM Microbalance's page. So I'm on their Instagram. But I also have my own Instagram. They can put my Instagram name in. It's dr.susanc. I can answer more health-related questions. They are experts in the products. But you can DM Catherine or Nicole at Microbalance about specific belongings, and she will try to help you as best as possible. Oh, that's good to know. So Catherine said sometimes you could store things and revisit when you are better. Wow, that's great, right? So you can store them, and then I'm assuming you would just store them in like those Costco type storage bins. Thank you. Satiated, but thank you for putting my Instagram. It's actually dr.susanc. So there's a dot in between there. dr.susanc. And my storage room where moldy stuff, hold on, see. And my storage room where my moldy stuff was stored. Okay, I also use the fogger. That's actually great. So you're going to the storage area and also fogging it. Do you have a fogger from them, or tell me about that? And then we'll post the full video. Yes. Yes. And they will also post links to my page. Any other questions, guys? Any last questions? Nicole or Catherine, anything that we didn't talk about, that we didn't speak about that's important? I'm just looking to make sure I didn't miss anything. So yeah, all you need is the clear tape, the pack of the 6, permanent marker, aluminum foil, and then a small plastic bag. So you'll put them in the small plastic bag after you cover them with aluminum foil, and then a timer. So you don't really need a lot at all. Oh, several foggers on Amazon. What are the difference, guys, between, is a fogger a fogger? So are there foggers that are better than other foggers? Like, for example, is it what they're using? Is it the type of actual machine? I'm interested in that. I'm going to let her answer that one last question, and then anything else, guys? We will post a case study article from me next week to see an in-depth look at how I use the plates exactly. I shared a really awesome case study I had of a patient of mine, and I wrote an article, so they're going to share it. And okay, so the Microbalance foggers are cold mist. Is it best to use the enzyme cleaner diluted or as is? Okay, so personally, I don't know if I'm wrong, but I just spray the solution. The enzyme, oh wait, that's the enzyme cleaner. So that question I don't know because that product is new. So we sell a regular one. Hold on one second. So it is best to use enzyme. So one question they have is it best to use the enzyme cleaner diluted or as is? That I do not know the question to. So I'm going to ask them about their products. And then Catherine said they sell a regular one and an electrostatic one. I'm assuming she's talking about the fogger. Both are wonderful and very easy to use. And then okay, so you can use the enzyme cleaner undiluted on tough stains and diluted for regular cleaning. And so one of the windows in my home, I live on a marina, and thankfully there's not like wood really around it, but there's a lot of metal and there could be condensation on my windows. So every week I use those wipes to wipe down the metal window just to make sure that no mold is accumulating there because there's moisture. So those wipes have been really helpful too. I really love the wipes. I don't know if you guys have used those yet. Perfect, that's what I thought. You're welcome. Any other questions, guys? Yeah, me too. I love those wipes. You can use those wipes everywhere, I think. I mean, I use them, especially when you're mold nervous. It's like anywhere I can use them. Let's see. Okay. I think I got all the questions answered. If you guys have any other questions. So yeah, if you have any questions about the products, you can definitely, oh, what are the wipes called? I don't know the exact name. I just know they're wipes. They're in my cabinet. I don't want to, oh good, you have the wipes too. I think I have literally everything. Used okay, so the wipes can be used anywhere and everywhere. They're just called EC3 wipes. Perfect. And what else? Okay, so any other product questions, you can definitely message. They're super helpful. I write them questions all the time that patients ask me. I use the mold solution on a car's old carpet and it works so well to kill the mold. That's awesome. I even just told the patient she doesn't have the finances to rip up her carpet. So I told her to get a cleaner, a carpet cleaner in her house because she's super sick. Her allergies are like horrible. And I told her to use the solution in the carpet cleaner. So that's perfect. So you use it in your car, which is great. Even on food surfaces. Oh, food surfaces. The wipes on food surfaces. I have the air doctor, probably this. So I have an air doctor in my living room because someone asked what air purifier would you recommend? And then I have an IQ Air in my bedroom. I had that one for years. I like the IQ Air. I love the air doctor. Those have been really good recommendations. Oh, where you prep food. Okay, on food surfaces. I'm sorry, I'm thinking, it's been a long day. I have patients all day. I was thinking on food surfaces. Okay, that makes sense. You can use the wipes on areas that you're cooking or preparing food. I use the wipes to clean my kitchen counters. Amazing. Yeah, I do. It depends. The Jasper, I actually haven't heard that one. I personally have the Air Doctor and the IQ Air. I really like those. And then for internal mold testing, I really like either Great Plains or Vibrant Labs for people if they want to know, do I have mold in my body, right? And people can do urine tests. That's super helpful from those companies. So EC3, air filters, and all their products be a great way to start if you want to protect yourself in your environment. Okay. Do you have any other last questions? Okay, so keep following Microbalance. Also follow me so that you can ask any questions that's related to any questions. I'll also use as inspiration to do posts about it. I'll make sure I can write articles about it. So if you have any topics that you want me to talk about, you can definitely message me or Microbalance, and then we can come up with more content that you actually want to learn about. What is the mold solution? Last question here. So what do you mean, what is the mold solution? What is it made of, or what is the name of it? So EC3, I think it's called their concentrate or their spray? I don't know. I have all of them under my counter. I don't remember the exact names. Yeah, EC3 mold solution concentrate. I was close. Okay. All right, guys. It was so nice to join you today. I really hope this was helpful. Again, contact us if you have any questions. If you're in need of anything, let us know. Catherine, am I accepting new patients? Yes, our practice is accepting new patients. So we are fully virtual as of right now, except I do see patients in New York City a few times a year, as well in Los Angeles. But it's me and Dr. Sparks in my practice. Dr. Sparks is a naturopathic doctor like myself. She is also an expert in mold. She is also a acupuncturist, as well as has a master's in Chinese medicine. So between either of us, we are very thorough root cause naturopathic doctors. We usually have consults with our patients like I said, most of them are virtual. We can get your entire case, recommend what we think is best, and then obviously any testing, and then give you very specific plans of action on how to heal. So you can also check out my website. It's naturallysue.com. And it has about my practice, patient testimonials, if you go to the results page, so you can see other patient stories. We also have a great article by Dr. Sparks that just went up called How to Detox Mold. That's on my website. And we also have other articles about other health issues. So we're really into helping the chronic disease community and everyone in between. So nice to join you guys today. Thank you so much. Yes, and that's my website. Okay, guys, I'll see you soon.